Breast cancer is the most common cancer in women in the U.S., and October kicks off Breast Cancer Awareness Month.
Our medical expert, Dr. Payal Kohli, joins us this morning. Thanks for coming in.
Good morning.
This is so important to talk about because some of the screenings and prevention has changed as well. So what should we know?
You know, it's incredible. Breast cancer, as you said, is the most common cancer in women. Every 2 minutes, a woman is diagnosed with breast cancer. And yet what we're seeing is that earlier and earlier women are being diagnosed. And so the screening guidelines have actually changed to address that discrepancy. And now, starting at the age of 40, we should start getting regular screenings for breast cancer. And most women don't realize this, but an important part of screening is actually checking yourself every single month.
Yeah, it's impressive how many women say that, you know, had they not heard on TV or a friend that they would have never been tested, and they were able to catch it early because of that too.
That's right, yeah, and it can be really subtle. I remember in medical school when we were learning the breast exam, they had these breast models and there were lumps hidden in them. And it was really hard sometimes to detect something because it has to be about half an inch before you can pick it up. And the timing of when you sort of check your breasts also really matters because women's breasts get lumpy throughout their menstrual cycle. So about a week after your period, every month, you should do a self-breast exam. You should do it in a clockwise fashion, so you're doing sort of a systematic exam. Make sure you check the armpit as well, because breast tissue goes into the armpit. And what you're looking for are lumps or bumps. You're looking for pain. You're looking for changes in the skin on top of it. You're looking for bloody nipple discharge. You're looking for anything that feels unusual. And if you get in the habit of checking your breasts every month, you will know when something feels different.
Well, and I want to expand the conversation because, of course, we're talking about women, but I hope men are listening as well because we can get breast cancer as well.
They can. And, you know, I have a friend from medical school from Harvard surgeon, he got diagnosed while he was in training. And we don't realize this. We think it's just a woman's disease, but 1 out of 100 breast cancers are in men. And so it's important even as a man for you to examine yourself. And if you feel something, pain in the armpit or pain in the breast tissue itself, make sure you go and get that checked out.
So when you talked about the guidelines changing for women at 40, is that a mammogram at 40 is when that should be scheduled?
That's right. Yep. So schedule your first mammogram at 40. And it's important to know what kind of breast tissue you have because the denser breasts you have, the risk goes up because you have more glandular tissue, less fatty tissue, but also it's harder to see on a mammogram. So some of the guidelines now are incorporating and pushing the insurance companies to cover MRIs for women that have dense breasts. Because if you actually see what a mammogram looks like on a woman with a dense breast, it's white on white. So trying to pick up a white tumor on a white background is very difficult because they don't have that black fat as a background. And so an MRI is really much more sensitive. So knowing not just, of course, your personal risk according to your family history or genetics, but also the density of your breast tissue. And that's a conversation to be had with your doctor because feeling a breast, you can't tell if it's dense. The size of the breast doesn't tell you if it's dense. So really talking to your doctor and saying, what did my mammogram show? Do I have dense breast tissue? Do I need an MRI or an ultrasound to follow up? And Katie Couric was diagnosed with breast cancer.
Right, yes.
She made a big campaign about talking about dense breasts and how common they are.
What about women that have implants? Does that change the screening?
You know, women with implants, it can be harder to see the breast tissue. So they should still get the mammograms, but it's really important to actually talk to the technician about your implants because number one, when you have a mammogram, it sort of squishes the breast. So it can certainly put the implant at risk for rupture. But number two, they actually have to do 4 more shots to kind of move the implant out of the way, push it back towards the chest wall so that they can really try to get a sense of what that breast tissue looks like. So having an implant is a risk for breast cancer. There's other sort of risks that we have as well, like modifiable risks. Women who use birth control, oral contraceptive birth control, because the breast tissue sees more hormones. Those women have a higher risk. Smoking, obesity, and in fact, alcohol use. The more alcohol drinks you drink, the higher the risk of breast cancer.
All right, a lot to be on the lookout for, so we appreciate you coming in and helping make us aware about it.
Yeah, thank you.